Hi, my name is Catherine Buchanan, and this is the skeletal video assignment. So we're going to start by labeling the bones. So this one right here on the side is your parietal bone, this big one right here. The zygomatic bone is your cheekbone, that's right here. See that? Yeah. And then the rhomboid suture, that is on the back right here, in this area. Oh god. Right in here. The external acoustic meatus, that's where your ear is, that's right in this area. The maxillae, that is right here. The palatine bone, that you can't see from here, but it's on the inside, right on like the roof of your mouth. The cervical vertebrae, that's the first 7 vertebrae right here. The scapula, that is your shoulder bone right here. The supraspinous fossa, that is on top right here, this little cavity here. The glenoid cavity, that's what your humerus sits in, it's right here. The acromion is this little part right here on the top of your scapula. The xiphoid process is the bottom of your sternum, so right here. The floating ribs are right here. These ones. The radius is right here. It goes along with your thumb bone. The trapezium is one of your bones in your hand. Okay. It is right here. The pollex is your thumb, so right here. The obturator foramen is right here. It's the opening of your hip, right in here. Your coccyx is your tailbone. It's right here. The pubic symphysis is where your hip bone is connected, right here. The acetabellum is where your femur sits. It's this little hole right here. The greater trochanter is the outer part of your femur. The gluteal tuberosity is right in here. The fibula is the smaller of your 2-legged bones, it's right here. The calcaneus is your heel bone, so right here. The metatarsals is the first line of bones, it's these ones. And the hallux is your big toe, so right here. The next thing is the joints. So your elbow is a hinge joint. It only goes one direction. Elevation, that is the upward movement of a joint. And usually that's talking about the scapula. So when you flex like that, your scapula will move up. That's elevation. Ball and socket, that's your hip joint. This part right here. That gives you like full range of motion pretty much all the way around. Vertebral joints, that's in between your vertebrae on your back right here. Gliding joints, that's your hip or your wrist joint right here, and it glides and it allows for pronation, supination. And then rotational, that would be the movement that your neck does when you turn left and right. That's a gliding movement, so right here he doesn't really do that. And then the knee joint, so the bones of your knee joint right here. This is your femur, this is your patella. The bigger bone is your tibia right here, and then your fibula, the smaller bone, is not weight bearing at all. And then I'm going to use the pencil for the tendons. So right here, the tendon that connects your femur and your patella is your quadriceps tendon. The one that connects your patella and your tibia, so right here, that's your patellar tendon. And then you have tendons around and inside. The one inside is your ACL, your anterior cruciate ligament. It runs on the inside right here and keeps your knee stable. And then you have on the back of your leg the posterior cruciate ligament, so that's right here. And then on either side of your knees you have your lateral collateral ligament and your medial collateral ligament. And then you have the meniscus on the inside of your knee right in here. And that should be it.